All right. In addition of the interviews, there was also a very big gap that was discovered, that very many women were not able to have food, but also it brought in issues to do with the gender-based violence, where women were experiencing a lot of violence, and this violence was actually related so much to the food issues. The man who was able to look after the family, they were not able to do that. Some of them ran away from their homes. Those who were able to stay there, the violence actually was too much. And this is something that during talking to these women, it was something that was always evident. And even there was a gap that was realized that however much the government had pledged to give food to people around the central area, especially Kampala and Wakiso, this was not something that was applying to most of the women who were outside those areas. So this food was given out, but it wasn't having a criteria that whether you're HIV positive or not HIV positive. So it was like for everyone. And this actually was very, very touching, that when it came to lack of food and lack of what to eat, and then your own medication, and then you have a family, it was really, really very, very bad. So as we also try and look forward to look for funding that is for people living with HIV, let the priority be to these organizations of women living with HIV that might be small, but they are doing a lot of impact in the community. So as we look forward to working on various things, let's ensure that GBV is something that is fought. Also sustainability in terms of having families have what to eat is something. And also let us also make sure that access to services, whether it is SRHR, whether it is HIV treatment, whether it is any service that is health related, should be accessible, should be affordable, and should be acceptable, or acceptable by women, in terms of ensuring that no woman dies or no woman loses her life when she doesn't have what to eat, she can't access services, and also she's been violated by the partner. So with that said, thank you very much. Yeah. Bye.
Thank you.